Good afternoon, Dr. Berger.
Good afternoon, Irina.
We often hear that an annual physical is the foundation of preventive care, but is it possible to have a normal physical and still miss early warning signs?
Absolutely. A traditional, typical physical that you might have performed in an insurance-based, let's say hospital-owned practice, is very basic. It's going to be your vital signs, your straightforward, routine, limited physical examination, a brief chat about your history, what's going on at the moment, maybe a few minutes on lifestyle, uh, and then basically get limited routine blood work. Might be a blood count, a metabolic panel, maybe an A1C for diabetes, a cholesterol panel, a urinalysis if it's indicated. It's quite limited.
What are some warning signs that routine blood work may miss?
So there are markers in the blood that can convey increased cardiac risk. These are things like apolipoprotein B, lipoprotein little a. These are part of the European and the Canadian guidelines for assessing cardiovascular disease risk. They're just come finally into the United States guidelines, but these are still not routinely done in primary care, and it often takes some time for the new guidelines to actually find their way down to regular primary care practices. I also didn't mention that the cancer screening is pretty limited in a traditional setting. The guidelines by the United States Preventive Services Task Force are really limited. And so a lot of cancer signals can be missed in a routine physical as well.
So, how is a comprehensive preventive evaluation different from simply checking whether your labs are normal?
Okay, so first of all, we're going to spend much more time on history. I go deep on family history back to grandparents, personal medical history, and also we spend quite a bit of time on lifestyle. My physical is usually 1 to 2 hours long, and I really like to take time to delve into the patient's lifestyle because this is the primary thing that can be changed to decrease risk of chronic diseases, whether they be metabolic or otherwise. And we also offer two types of cancer screening at a discount. One is by blood. The Gallery blood test looks for over 50 different cancers by testing for cell-free DNA in the blood, and also a discount on whole body MRI. And these discounts are just passed on to the patient. We don't make any money on those particular tests, but I think they're important depending on the cancer history in the patient's family or their personal cancer history.
And the last question I have, what is one thing you wish every patient would ask their doctor at their next physical?
What they think might be missing. What can they offer in terms of additional screening to make sure that they're having their cholesterol checked adequately, their metabolic parameters checked, and that's going beyond the A1C for diabetes detection in the metabolic panel, but perhaps looking for a fasting insulin level that might detect insulin resistance earlier, things of this nature, because the traditional physical, as we just discussed, often misses a lot of the early signs of metabolic disease.
And often we hear, instead of some recommendations like nutrition recommendations and workout routine, right? With the 5-minute visit, usually you hear eat less and move more,
Exactly.
Right? So can you tell us, if the patient's interested in finding us, where they can find us?
So I'm Dr. William Berger. We're a Northeast medical practice located in Great Neck, New York on Long Island. The office phone 516-604-3418, online at northeastmedicalpractice.com, through our various social media channels where you're probably seeing us right now, including our YouTube channel. You can also check out my podcast called Longevity MD on Spotify, where I interview other clinicians and talk about all sorts of health optimization topics. So remember that everything we discuss on these videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have specific questions or concerns about your health, please don't hesitate to reach out to your healthcare professionals. But until we see each other next time, be in good health.